Hello and welcome. We have put together a skit that exhibits nurse-patient teaching on an acute cerebral vascular accident. We will incorporate thought-provoking questions throughout the presentation, so please share your answers at the end of the video. Med-Surg Unit, this is Nurse Scarlett speaking. How can I help you?
Hi, Scarlett. This is Maggie from the Critical Care Unit.
Hello, Maggie. How are you?
I'm good. I'll be giving you a report for Miss Grace Williams.
Okay, perfect. I'm listening.
She is 89-year-old African-American female, newly diagnosed post-acute CVA. No known allergies. She'll be transferred to Med-Surg room 320.
All right, perfect. Thank you for giving me the progress notes. We'll go ahead and be looking out for the patient. Thank you very much.
Have a good day. Bye.
You too. Bye-bye.
The nurse enters the room. She performs hand hygiene and maintains patient modesty.
Hello, good afternoon. My name is Scarlett, and I'll be the nurse attending you during this evening. Can I please have your name and date of birth?
My name is Grace Williams. I was born January 5th, 1931.
Would you mind if I take a look at your patient identification band? Perfect.
Mom named my sister after my grandma. Hello, my name is Peter, and I'm Grace's grandson. My grandma has many concerns about her health. I'm here to help her express her concerns. My grandma has felt like she has lost her independence, and she feels like a burden on others. And it really frustrates me because I don't want her to feel that way.
Hello, Peter. Nice to meet you. I understand this must be very difficult for you to see your grandmother this way. We are doing everything we can to keep her as comfortable as possible. If either you have anything you want to talk about, please do not feel afraid or ashamed. I'm here for you. Grace, do you know what day it is today?
I don't quite remember. Can you remind me?
Of course. Today is Friday, April 17, 2020. Do you know where you are?
Well, after all these years of working in a setting like this, of course I know where I am. I better know where I am. I'm in the bed at a hospital.
It's going to be okay, Grandma. If you need anything, please just let me know. I'm gonna stay here with you.
I just hate this whole damn situation.
You seem frustrated. Tell me more.
It's just that I've been an RN for over 60 years, and I never thought that I would be on the other side of the wall. You know, I feel so sad the more I think about my situation. Please forgive me if I seem mean or aggressive. I just don't understand. Why me? Why me? Why me? I just pray that this whole thing is over soon. I'd rather be happy and called home than to deal with all these new things arising with me and at my age. It's all too much for me and my family.
This must be very difficult for you as you are now at the hospital as a patient dealing with new obstacles. I want you to know that it's okay to have feelings about what is going on at the moment.
I just spend so much time trying to live a healthy life, and yet I'm in the exact position that I tried so hard to avoid.
Grandma, I understand your concerns. You seem frustrated. You can share that concerns with me. Please don't bother the nurse.
I understand this is a very difficult time for both of you, but I am here to address any worries or concerns that you may have. I empathize with you, Grace. I want you to know that I am here to help you, and I will be here for you in any moment you need. And if I can't be here at the exact moment, I will send another team member to assist you until I can come. But I will come. Your health and well-being is our number one priority. Okay? I wanted to ask you a few more questions. Is that fine with you?
Yes.
All right. Do you know why you're here?
Well, I remember I had an extreme headache. My face started to lose sensation, my vision became blurred, and I tried to get to my life alert as soon as I could, but that's all I can remember. I remember becoming weak in the process, but that's as far as I could remember. I know the signs of a stroke. Is that what happened to me? Did I have a stroke? Is that why I'm here?
You are right. You experienced an acute cerebral vascular accident and you intervened promptly by pressing your life alert. How do you feel? Is there anything unusual? Are you experiencing any pain at the moment?
Well, yeah, I actually do have pain. There's things that are unusual. I wet the bed and I didn't even realize it. It feels like I lost sensation from my waist down.
So this urinary incontinence is new for you?
Yes, and I have discomfort in both of my legs I've never felt before.
What is your pain level on a scale of 0 to 10? Being 0, no pain at all, and 10 being the most pain, the worst pain you could ever feel.
Uh, I'll rate my pain at about an 8 out of 10.
And how would you describe that pain?
It feels more like a sharp numbness pain.
What is your acceptable level of pain?
Well, what do you mean by that? What do you mean by acceptable level?
Does your pain interfere with daily activities, such as reading? I noticed you were reading a book earlier. Do you feel like you could read a book now?
Oh no, I can't concentrate on reading. The pain is just too much.
Okay, that is valuable information. I'll make sure the doctor knows. We can address the discomfort you are experiencing with medications and other interventions.
Please let the doctor know.
I will go ahead and let the doctor know. The call button is right beside you. When you press it like this, a light and alarm will notify me that you need assistance. Please don't get out of bed without any assistance from myself or another team member. Your safety is our number one priority. I'll be back soon to check on you. Do you need anything else before I leave?
I am kind of thirsty. Maybe a glass of water?
Okay then, I'll see you in a bit.
You know, I just don't like to depend on anyone. It's going to be a burden on the family.
It's not, Grandma. We will continue routine taking care of you, and we will visit you until you go home. We love you, and we want you to feel comfortable. And don't say that you're a burden on us, because you're not.
Hello, Grace. Here's your glass of water.
Thank you so much.
You're welcome.
Nurse,
Yes?
I just want to say thank you for making me feel comfortable. You kept your word, you looked me in the eyes, and you offered yourself to my grandson and I. I've never felt this comfortable with a stranger before. So thank you.
What do you think is causing the patient to open up and thank the nurse the way she does?
No problem, Grace. This is what I love to do. I'm here for you. Anything else?
No, that's all.
Okay. I'll be speaking with your doctor and see if she wants to hold you for longer or will discharge you today.
Hi, nurse. How is Miss Williams doing this morning?
Hello, Dr. Rita. She is alert and oriented with some forgetfulness. Temperature is 97.8. The heart rate is 77 beats per minute. Respiration rate is 16 breaths per minute. Blood pressure is 136/62. She is complaining of a pain of 8 out of 10 on both her legs. There is no swelling, and the ED X-ray reports no fractures. As of now, she has acetaminophen as needed for pain.
Let's start her on physical therapy for impaired gait and muscle weakness due to her CVA. The pain she must be feeling is neuropathy from the acute CVA. Let's start her on gabapentin, 300 milligrams every 12 hours, and baclofen, 5 milligrams 3 times daily. Thank you.
Thank you, Dr. Rita. Hello, Grace. Dr. Rita wants to keep you a little longer to make sure your pain is well managed. She has prescribed 2 new medications for you today. But before we get started with your medication, I'd like to teach you about how you can reduce the chances of another CVA.
Okay.
Diets are very important. We want to make sure that you are on a low sodium diet to help control your blood pressure. A controlled blood pressure will help reduce the risk of a CVA. Also, we would like to include fresh, frozen, or dry vegetables so that you can have proper nutrients, including potassium, to further help your blood pressure. We want to stay away from the breads and rice that are not whole wheat or brown.
This is going to be a challenge, but I'm sure I'll do it because my life is at stake.
Grace, I understand that this will be a challenge for you, so I will give you the information to our stroke management program here at the hospital. They help you with diet planning, and they are a 24-hour line that you can call when you need to speak about your diet.
Wow, that's great. I'm sure I will utilize them.
Okay, can you repeat to me the type of diet that is necessary for you to follow and why?
Yes, I need to have a low sodium diet, incorporating more fresh vegetables, dried or frozen, and staying away from white rice and bread. And this is all going to help me control my BP. I get it. The point is not to have another CVA. I get it.
Okay, great. We will move on to your medications. Have you heard of gabapentin and baclofen before?
Well, yes, of course I have.
Okay, let's start with gabapentin. What do you know about this medication?
Yeah, it treats seizures and nerve pain in patients with diabetes and stroke.
Absolutely. Do you know what side effects to look out for?
Ah, I know this medication like the back of my hand. I administered it to many patients in the past. Why can't I remember it right now? I just can't put my finger on it.
Well, Grace, it's okay to not remember some things. You just had a CVA, and loss of memory may occur as a result when specific parts of the brain are affected by the stroke.
Wait. What is this medication? Is this medication habit forming? I know doctors prescribe medication that gets people addicted.
Gabapentin is often prescribed for neuropathic pain, like what your grandmother is experiencing. It can also treat convulsions, which can occur with stroke. After your grandmother's pain is well managed and with increased exercise per muscle strength, we can ask Dr. Rita if we can taper this medication down.
Nurse, I have a question about my medication. How long will it be prescribed for? I'm not used to taking medications as prescribed. Normally I forget, and I'm not sure if I remember to take this one.
Only your doctor can decide when she is going to take you off the medication. However, I'd like to address different methods we could incorporate that might work well in helping you take the medication as prescribed. Do you think we could set up an alarm on your cellular device to remind you when it is time to take your next dose?
Yes.
Perfect. I'll help you set that up. Dr. Rita will start you off with gabapentin 300 milligrams by mouth every 12 hours. Some adverse reactions to watch out for include ataxia, dizziness, fatigue, and somnolence. Adverse effects usually are mild to moderate and decline with time. We will closely monitor you while you are taking the medication. While you are taking the medication, we will monitor your renal function. We also want to avoid any antacids, but if you must have one, you may take it at least 2 hours apart. Dr. Rita also ordered baclofen 5 milligrams by mouth 3 times a day. Baclofen is used to treat muscle spasms and the urinary incontinence that you've been experiencing by improving urinary sphincter function. Some adverse effects are dizziness, drowsiness, fatigue, weakness, and confusion. Do you have any questions about the 2 medications that we just went over?
No.
Please feel free to stop me at any time with any questions or concerns. Remember, I am here for you. I want you to understand what you are taking. I'd like to share with you this notebook that will allow for you to write down the medication and the time that it needs to be taken.